Once a problem has been identified, we have to figure out how to treat it. If a patient is feeling minimal or no symptoms, usually we can observe them, maybe give them some medications, and hopefully they'll just get better. The next stage of treatment would be physical therapy to try to regain strength, improve range of motion, improve flexibility, and try to build up the core, which can sometimes become weaker in patients who have back pain. After that, if the patient is still hurting, one of the beauties of working at THCDS is that we have every diagnostic and treatment modality available. If the patient needs further imaging, such as an MRI, we can get it done. If the patient needs spinal injections, either in the neck or in the back, those can be done very expeditiously too. A very small percentage of patients who have a herniated disc or spinal arthritis or spinal stenosis may need spine surgery. Developing a surgical treatment plan starts with talking to the patient. We have to figure out exactly how bad the problem is and how impaired the patient is, with a realistic goal of trying to make them feel better. Some patients may need a fusion, some patients may need a disc replacement, some patients may need a smaller surgery such as a discectomy. And our goal at Texas Back Institute is to try to do the right surgery for the right patient at the right time. We're proud of the fact that our results are very good because it starts with determining what the patient wants, what their goals are, and then identifying the surgery that they need. At THCDS, we do thousands of spine surgeries, including spinal fusions, disc replacements, discectomies, pretty much every procedure that is available for anyone who has a spinal condition. But for an individual patient, that is a very personal decision that should be made in conjunction with their doctor. My advice for any patient would be to find a doctor who will listen and find a doctor you can talk to. Because even after the surgery is done, it is very important to have good communication with your surgeon so that they know exactly how you're feeling.